Navarre. Dr. Navarre worked in a private mixed animal practice in Texas following graduation from Louisiana State University School of Veterinary Medicine. She joined the food animal section of Auburn University College of Veterinary Medicine Teaching Hospital, where she spent the next 11 years providing clinical service and teaching food and camelid medicine and surgery. She then returned to LSU, where she's currently an extension veterinarian at Louisiana State University Ag Center. Dr. Navarre is past president and current parliamentarian of the American Association of Bovine Practitioners, served on the American Medical Association of Small Ruminant Practitioner Board, served on the American Veterinary Medical Association Food Safety Advisory Committee. She is also the past president and current treasurer of the North American Veterinary Community Board. Dr. Navarre has chaired numerous publications and been very active in continuing education. Dr. Navarre, thank you for your leadership with this paper, and we are looking forward to hearing your presentation.
Thanks, Kent. And thanks everyone for joining out there. I wish we were all in person, but times are really unsettled right now. I hope you're all staying safe and healthy during this pandemic. This is my first webinar to actually present, so I'm a little bit nervous, but have no fear. I am picturing all of you in your pajamas sitting at your kitchen table. So the first thing that I have to do is thank my task force members. This would not be possible without them. They are actually the subject matters expertise. That's where it came from. And I'm basically just took what they gave me and put it together. And it was really great to get to know some of these people and work with them. I also want to thank the CAST staff. The CAST staff really worked behind the scenes to keep this rolling and give us the support that we needed. So why does this matter? Food animal veterinarians, and I think this COVID-19 outbreak is really putting public health into the spotlight, and food animal veterinarians are at the forefront of public health, and that we have to have global food security to maintain public health. And food animal veterinarians are involved all the way from, animals on the farm, taking care of animal health and welfare, all the way, whether you say farm to fork or, pasture to plate, all the way, research into food safety, being inspectors at our harvest facilities, being in USDA, FDA, lots of different avenues that food animal veterinarians protect our food supply. They are critical to ensuring the financial stability of producers, and very critical to maintaining the financial stability of the U.S. If we were to get a foreign animal disease that would impact livestock or poultry or aquaculture, similar to COVID-19 causing this pandemic in people, it would also, just like COVID-19 is doing, it would be financially devastating to our entire economy, not just to animal agriculture. And food animal veterinarians are on the front lines of this. So the veterinarian's oath is really my touchstone. When I'm having a bad day, I go back to it to remind myself, this is what I'm passionate about. This is why I became a veterinarian. And I think most people in the general population think about veterinarians protecting, pets and protecting animal health and welfare and relieving animal suffering, but I don't believe that everybody thinks about the things that food animal veterinarians are especially involved in, and that's conservation of animal resources and promotion of public health. And I think, as you'll see, I'll mention a few more times, that we need to make sure that people are more aware of what all veterinarians do, not just those that take care of pets. So what do food animal practitioners actually, or food animal veterinarians actually do? They work in both private and public practice. When it comes to private practice, I think that we have to be careful because there's a lot of terminology and it gets confused, and people talk about food animal veterinarians, they talk about large animal vets, rural vets, and sometimes use those interchangeably, and I'm certainly guilty of that too. But we really have to be careful when we're looking at the literature and when we're talking about these things that we're clear on what we're talking about. Most of the time when people talk about food animal practitioners, they're thinking of rural practitioners, and sometimes those practitioners are exclusive food animal practices, but a lot of times those are mixed practices that are doing some food animal species, but they're also doing companion animals. There are also food animal exclusive practices that are not rural. If they're consulting practices that travel a good deal, they may actually, the practice offices may actually be in an urban area, but they are traveling to rural areas to see their clients and animals. Public practice is very varied, and it makes it a little bit difficult to get a handle on some of the data because you really need to be specific about which group you're talking about. But USDA, FDA, CDC, those government agencies, armed services, and then academia and industry. So I think we can all agree that food animal veterinarians are important for food security, for public health. So what the committee did was try to maybe rephrase what we were given from CAST and come up with a question, central question that we wanted to try to address. And that is, why is it difficult to recruit and retain food animal veterinarians? And I want to start out saying that, this effort, again, took a lot of people, and each section of this paper could really be an issue paper in itself, and really trying to pare things down and figure out what to put in and what to leave out was not an easy task. But at the end of the day, what we hoped to accomplish was that we really kind of brought all of the issues to the forefront and not just focus on a few issues that are maybe low-hanging fruit or easy or that get a lot of press. So there are a lot of other references out there that maybe we didn't include. There are some things that probably people would like to have seen expanded on. But at the end of the day, hopefully we can further some conversations with this paper. So it comes down to supply and demand. And one of the questions that gets asked frequently is, where are we now? Do we know how many veterinarians do we have? How many are in food animal practice? Do we have enough? Do we have too many? Is there a maldistribution? And I frequently hear this, there's a shortage of food animal practitioners, or there's a shortage of rural practitioners or large animal practitioners. Again, those terms get used interchangeably. And I think we have to be really careful using that term because it implies that we don't have enough veterinarians to fill those spots, and that just training more people or recruiting more rural students or students from a rural background in general is going to fix that problem. And I think there's some underlying reasons why there aren't veterinarians in those areas that have to be fixed before training more people, and getting those people there will actually help. There are a lot of different workforce studies, and there's a really great summary of those by Dr. Mike Dix from 2013 that, if you're interested, it's a really great place to start. And there are conflicting results over the years. The AVMA database is used in a lot of those, and fortunately, that actually represents a good majority of veterinarians in the U.S. There are, drawbacks to it, but it's the best we have, and it's actually a very good database. What's a little bit tougher to get a handle around is on the demand side. What does the metric need to be? Do we need, so many veterinarians per animal? Do we need so many veterinarians per farming operation or ranching operation? Do we need so many veterinarians per animal density? We really don't know what that metric is, and it probably varies depending on the geographic area. It probably varies between the species that we're talking about. And so we've got to look at all of that, and then it is a moving target. And so if we had a recent workforce study come out before Christmas, we can throw it out the window because COVID-19 is changing the landscape. You know, dairy practitioners in particular were already hurting, and the dairy industry right now, all ag is hurting, but the dairy industry in particular seems to be really hurting, and that is going to have an impact on the need for veterinarians. So it's going to be interesting to see how we go forward. And again, I think that quote shortage of food animal veterinarians that gets talked about has been used to justify some changes, and not to say that those aren't necessary, but I think we're missing the big picture if we just focus on some of these things, you know, increasing class sizes in new veterinary schools, proposed changes to veterinary practice acts. I think those are helpful in some cases, but they're missing out on some of the other issues. So we talk about, we typically say supply and demand, but in this case, we're going to talk about demand first, because really, you know, we need a demand out there before we think about recruiting and retaining veterinarians. You know, training veterinarians is costly and time consuming, and we need to make sure that there's a need before we put those resources to recruitment and retention. So demand from a private practice standpoint, there's a lot of consolidation and vertical integration of animal agriculture, especially depending on the species. If you look at poultry, it's highly integrated. If you look at the beef, cow, calf sector, it is very spread out, and you know, 20 to 30, 40 producers, depending on the state, is or animals per producer is the average. And so I think you need to take those species and those industries separate when you look at this, and you need to take into effect that geographical areas are going to be different. Bovine Veterinarian is a publication, and they recently, at the first of the year, when the year 2020 rolled in, they asked key opinion leaders, bovine veterinarians, what they see happening in the next 20 years. And several mentioned that they saw continued consolidation and vertical integration continuing to happen in the cattle industries, and that will probably lead to a decreased number of veterinarians needed in that segment. Now, having said that, I think we need to, you know, take a step back and not panic and say, oh, fewer veterinarians, you know, are we really risking the health and well-being and food safety? And I don't think so. I think, you know, we've seen agriculture, all segments of agriculture get more efficient, use technology, and veterinary medicine certainly isn't any different. And so I don't want anybody to think that fewer veterinarians is risky. We just have to make sure that those resources are used appropriately and efficiently. Fluctuations in farm profitability, we're absolutely seeing that right now. And then I think we need to do a better job of selling our value proposition to our current and potential clients. You know, I think a lot of times veterinarians are just seen as a cost, and we're not recognized, and some of that's our fault for not standing up for ourselves and selling ourselves, but our producers may see us as a cost instead of somebody who is more of a partner and then can actually help them make money. This is some USDA Economic Research Service data that looks at all of the expenditures in a cattle production operation. And when you look at it, if you look up veterinary medicine, veterinary services and medicine really only makes up about 4% of that. So if you're trying to cut that back, you're really not going to have a huge impact on your overhead. Some of these other segments are really need to look at. And when a disease gets into a herd, we know that it can have devastating financial impacts. Public practice, again, I think COVID-19 is the good thing that's coming out of it is the increased focus on public health and how veterinarians are actually critical to that. but then, you know, who pays for that? I think that's the big question. And we all know that there aren't unlimited funds, and that government funding priorities change, and we have to continue to keep public health up there. You know, research dollars have fallen off. Support for, you know, colleges and universities that do that research and faculty have fallen down, and we need to make sure that money is going where it needs to be, and we make public health a priority. There's also some interesting changes. While much of animal agriculture is consolidating and integrating, you also have a movement to more what we call backyard food animals, and I think backyard poultry is a great example of that. A lot of people who've never grown food or thought about growing food are getting chickens and eating the eggs and selling the eggs. And, you know, those people may look at those chickens as pets, and when they give them an antibiotic or a drug, they may not realize that, you know, wow, I need to pay attention to residues and things that are top of mind to food animal veterinarians on a daily basis. These animals may also, the only veterinarian in the vicinity, since these are raised a lot of times in peri-urban areas, a lot of times they may not have a food animal veterinarian available. They may have a companion animal veterinarian. And again, food safety may not be top of mind to those veterinarians. Whereas as a food animal veterinarian, we are, you know, always have the animal welfare and health interest of our patients, but we always also at the same time think about food safety and food security. So solutions, I think in general, we just need to educate people better. We need to educate our producers. We need to educate the public about food animal veterinarians and sell ourselves better. You know, we really are One Health and need to be involved in those conversations. We need to make sure that we're matching services with the needs of our producers and coming to the table and finding out what they need. We also need to educate our colleagues, you know, as we have fewer people, you know, possibly fewer food animal veterinarians, fewer small animal veterinarians who have any agricultural background. I think that some of our colleagues are just as susceptible as the general public to some of the misinformation that comes out about agriculture. So we need to do a better job of educating everyone. Lots of international opportunities. There's partnerships. You know, wildlife needs to be part of One Health. So those are some of I think education is probably the take home there. So now we get to supply, which really was our charge, was to look at, you know, recruitment and retention. And so we've got to find people that are interested and recruit them. We've got to train them, and then we have to figure out how to keep them. And as I started to put everything from the committee together, at first I had recruitment separated from retention, but as I really gathered the information, really many of the factors that influence one influence the other. And so for the actual publication, we lump those together because I think it'll read a little bit better. So student debt is a profession-wide issue. It is probably the biggest issue facing the veterinary profession currently. Mental health is also a serious problem, and you know, student debt has a serious negative impact on well-being of both students and practicing veterinarians and people in public practice. And specifically, it's the student debt to income ratio. The average for the veterinary profession is 2.3 to 1, according to 2019 AVMA data. And that is unhealthy. If it's anything over 1 to 1, then that's starting to get into the alarming rate. Food animal veterinary graduates going into food animal exclusive jobs. And I think it's important that this is food animal exclusive jobs, which is about, thanks to USDA, for providing me some data, actually just yesterday, about 1,600 veterinarians are food animal exclusive out of about 110 plus thousand. And so not very many. So we just need to realize what group we're talking about. But they actually, again, according to AVMA in 2019, have lower debt and higher salaries, and thus a lower debt to income ratio. Rural practitioners, mixed and food animal predominant, have a debt to income ratio closer to the profession average. And we actually, the economist that was on our committee, I want to thank her. We actually went back and forth about whether or not to even include this, because while this is really interesting, we don't know what this actually means. We don't know what's causative. We don't know what's associative. So we need the data behind this, why this is, to really make more sense of it. And I think we have to be really careful because these are averages, and any individual graduate coming out may not fit those averages, and it's, you know, imperative that we take a look at these things. Student debt solutions, so far they're largely after the fact. So they're once the debt has already been incurred, and many are tied to rural or food animal practice, which is good. The most well-known is the Veterinary Medical Loan Repayment Program. There are some state programs. The Veterinary Loan Repayment Program, recent data shows that actually short-term retention is really good in the 70% of students who got those that are still in those areas. But what we don't know is the long-term impact of those. And what we also don't know is how does that compare to graduates who went out into areas and or practicing on food animals that did not get that loan repayment? Are they still in those areas? So we really need some long-term data to make sure that we need to, you know, continue these types of programs. If you look at data from physicians and physicians' assistants, they're not as excited about the long-term effects of these programs, that they're not as effective long-term, I think, as people would like. And then there are lots of elephants in the room, but the big bull elephant is, how do we actually decrease the debt load at graduation? And then in conjunction with that, we need to also work on how do we make sure that salaries keep up with that, that debt load. And we need to work on both of those. Interestingly, the percentage of students graduating with debt is actually decreasing, although the total debt is increasing. The number of students with zero debt is increasing. And this is a hypothesis that, you know, maybe more students of means are applying, and that definitely has diversity implications. So this student debt is changing or potentially changing the face of our profession, and we need to make sure that we are, again, keeping track of that and getting a handle on that. One of the other factors, if you look at most food animal veterinarians in the U.S., they're in rural practices, and this is where most of the talk about the shortage of veterinarians, it's in rural practice. And rural life definitely is not for everyone. We know that. Lack of social and cultural opportunities, work for significant others, you know, access to school, childcare, mental health issues. You know, rural practice salaries in general are lower on average than the rest of the profession. And then we've got long work hours and emergency duty with a lot of these practices that are a significant barrier to recruitment and retention, both. If you look at who wants to work fewer hours per week, it's those veterinarians in rural practice compared to urban and suburban. So definitely we've got an issue there that we need to work on. So do we just recruit more students from rural communities? I think that's been, you know, thought about and being done. But is that really effective just to recruit these students in general? And I think if you look at some recent data, 1 in 5 students are already from rural communities. And so how many do we actually need? And they are interested in food supply veterinary medicine, but how do we actually get them out there and get them to stay? And really interesting from data from physician and physician assistants on rural returners. They, after looking at this for years, show that community attachment is very critical for residential intentions of not only going to a rural area, but staying long term. So I think that's something that actually is being looked at in a few instances. So it's not just targeting rural students, it's actually targeting rural students, from a community. And so, communities may need to step up and say, we need a veterinarian, and, how are we're going to find somebody who's already from this community and maybe give them the support they need to get through school and get out. Cooperation between practices, childcare solutions, use of technical staff. We'll talk a little bit about this more in a minute. Cooperation with other health professionals. I think we all kind of tend to stay in our own lane. But once again, COVID is taking us out of those lanes, and veterinarians are being recruited to help on the human health side. And I think we need to support each other because we have a lot of the same issues. Food animal demographics. There's not a lot of data. The only data that I'm aware of is through the American Association of Bovine Practitioners. And if you look at bovine practitioner members compared to the AVMA database, the veterinarians in general, ABP members are older, more male, and have less diversity of race and ethnicity. It's really important that we try not to jump on, well, why is this, and really speculate. Everybody's got their opinions. Some people think it's discrimination. Some people think it's a choice. Some data shows that men are actually more likely to have positive attitudes towards rural life than women. Women are more likely to cite family time as more important than men. So there are gender differences in what we want. And that may, because most of the graduates coming out of school are women. If women are choosing differently, we have to take that into account. Is it generational? I have trouble separating gender and generation, because as we go through the years, we have more women, but we also have, millennials and Gen Zs, and they're definitely different than those of us that are usually hiring. And so we have to take that into account. And to me, it's very difficult to separate those things. And younger veterinarians want more work-life balance regardless of gender. So we have to take that into account when we're trying to recruit people to these rural areas in particular. We need more data, specifically other species groups. This is only bovine practitioners that we are able to find this from. And then we also have to get behind the why. We can't just say, well, this is the way it is. We have to understand why, because that's how we're going to figure out how to fix things. So this is, if you see the two on the left are bovine practitioners or higher male, and then it's flipped in the U.S. veterinarians in general. Practice attributes, these are particularly important to retention. I think, if you're interviewing a student or, someone to work in, a government practice, it's easy to sell all the good things, but when somebody gets in that position and they're there day to day, they learn, what it's really like. And so these practice attributes are particularly important to retaining food animal veterinarians. Practice models really need to address our producers are to be sustainable. They're demanding modern and up-to-date practices, and we need to deliver that. Our graduating students are demanding, a lot: good practice atmosphere, mentorship, good facilities, caseload, work-life balance, high salaries. That's a tall order for a lot of practices, but we can't ignore it. These things have to be addressed. Some of the solutions, we need more sustainable practices, particularly from a business standpoint. American Association of Bovine Practitioners has gotten 2 USDA grants to put on some practice analysis workshops, really helping practitioners dive into their business and their financials and human resource skills. Do we need to, shift from fee for service or tasks to, more consulting type practices? Diversification, it's so difficult these days to be a cattle veterinarian, and even, being a beef veterinarian and being a dairy veterinarian, it's very difficult to be both, much less know something about swine and poultry and small ruminants and aquaculture and all the things we need to take care of. So it's very easy to have a practice that is only dairy or only feedlot. But that does leave us vulnerable. We're seeing that when, dairy are going out of business, those exclusively dairy practices, those veterinarians are hurting. If we look to the farming industries and the farmers in my family, they're diversified. They have, they're planting multiple crops so that if one goes down, then hopefully the prices for the others keep them afloat. We can also look at diversification of services, which I think is always a good idea. And then modern equipment technology, telehealth. Rural practices need to be better at leveraging technicians. There are a lot of small animal practices that are very good at that. The ladies have to step up and say, we're going to fix some of these problems. If you're really interested and really passionate about doing food animal medicine and living in rural areas, and there's a group of ladies in Texas, and I didn't name them the Pink Vets of Texas, a lay publication did, but they looked at their childcare problems and they solved it. They brought childcare basically in-house. Mentoring is also something that students want, and I think that is very important for those of us, that are hiring, and to be willing to be mentored too. It needs to be a two-way conversation of what everybody needs and wants and can get done. Telehealth, and I just pulled this out. It's been on the rise. I think actually food animal veterinarians have been using telehealth and telemedicine for a long time. Again, feedlot veterinarians are, looking at data daily from their operations. They are looking at pictures, they're looking at videos, as well as visiting farms in person. But COVID-19 certainly has sped that up in all fronts. And it'll be interesting to see what happens after this, how much that, goes back to normal. But I think using technology is something that we need to embrace. Public practice supply, because public practice is so diverse, it's really, you've got to kind of look at each area individually, but we need better awareness. So not only is awareness important so that we fund public positions and public practice positions from whatever that is, government, private funds, but it's also important that people know that there are jobs out there and that there are great careers in public practice. And so we need better awareness with the public, with students, and again, within the veterinary profession. Competitive salaries have been issues for a long time, and a lot of work has been put towards that. We also need some help with postgraduate training. For instance, somebody who wants to go into, food safety research, and they graduate from vet school and they have, debt, and then they decide, well, I'm going to need a PhD and then a postdoc, and they've taken on more debt, and then possibly, they're delaying paying back that debt. That's not helping. And there's actually, I'm not really aware of the details, but I believe some legislation has recently been introduced to help maybe with funding access and the cost of postgraduate training. And again, hopefully that's something that comes out of COVID-19. So when it comes to recruitment and retention, there are a lot of ideas out there. And again, one of the things that we wanted to do was kind of put everything out there on the table so that we can attack this from multiple fronts. And so this is just the top of the one of the tables in the paper that tries to pull a lot of the strategies that are mentioned throughout the literature. It's certainly not an all-inclusive or exhaustive list, but hopefully will give people some ideas. And then we really can't have any of this without well-trained veterinarians. And we've got to, that's very important to maintain our relevance to animal agriculture, to public health. It also impacts recruitment and retention, and competence is an important component of employability. That's really a no-brainer, but in turn, employability impacts professional success, satisfaction, and well-being, which impacts retention. And so it's all tied together. One of the things that is very concerning to me, because I'm very close to it, is the erosion of food animal education at veterinary colleges. It's very troublesome. My colleagues that are teaching at the veterinary schools are, there's not enough of them to do all of the things that they need to do. And it impacts attraction and maintenance of students. It's just very difficult to remain upbeat when you're exhausted. And not that other areas of profession is not facing that too, but I particularly see it in my food animal colleagues. One of the things that's also concerning, I understand the need for tracking and the need, with so much information out there that, we need to really concentrate on one species maybe, or companion animal versus food animal. But our multi-species training is what makes us relevant to public health, and is very important in that conversation, and important in the One Health conversations. And so we need to make sure we maintain that. I've also seen, and I think a lot of my colleagues would agree with me, that has also, our public health and our multi-species training in veterinary colleges has been severely curtailed. And we need to do something about that, whether or not that's in veterinary school, whether that's post DVM graduation, I don't know, but we need to keep that in the back of our minds. And then as we have this erosion of food animal education, we also are not training our future educators and our future researchers. Residency programs, research programs have been cut. And so we're not replacing ourselves fast enough. Solutions, centers of excellence have been tried with varying degrees of success. Integration of funding is one of the largest barriers. How do you, share resources and across university and even state lines? Again, I think one of the good outcomes of COVID-19 has been that there's a lot of sharing going on, regardless of where anybody's from, and hopefully that is going to foster some breaking down of some of these barriers. I mentioned post-DVM training. It's expensive. If we want people to be well trained, particularly in public health, it's probably going to take a lot of post-DVM training, and we need to be able to make sure that salaries are attractive for those jobs, and that people, students have the help that they need to be able to take on that training. More and more, I believe that the food animal industries themselves are taking on that training, and even veterinarians are taking on the training. Veterinary practices, consultant practices they're hiring the best and the brightest, and then they're teaching them what they need them to know for whatever particular area that they're in. So to finish up, this is one of the most, my favorite parts of this whole paper. And I want to thank Dr. Clay Mathis for putting this together. And this was one of my goals, and the goals of the committee was to look at this from a systems perspective. If we can't just pick and choose what we want to look at, what's easy, what's popular, we have to look at all of the issues, and then we have to look at how interrelated they are, because when you change one thing, you impact other areas. And there are, vicious cycles that get started that are very difficult to reverse. And so I hope that you'll take a look at this. And if nothing else, I hope that it generates a lot of future conversation. And I think this figure really summarizes a lot of the issues that we talked about. So again, I want to thank you for joining me. This is just a very small snapshot of what's actually in the issue paper. Feel free to contact me if you have questions or comments, but I am going to turn it back over to our CAS staff who has been monitoring the questions. So if there are questions, I will take a few minutes to answer those. So thanks very much, everybody.
Thank you, Christine. I appreciate the presentation and sharing the insights. I'd now like to turn it over to Kim Nelson, who has been following your questions and is now in a position to share some of those with Christine.
Hello, everyone. Thank you for submitting your questions. I'll go ahead and make sure that some of these get read off and answered by Christine. So first, Christine, what are your thoughts on training small animal veterinarians to perform specific food item services, such as bull testing, bangs vaccinations, embryo transfer, field necropsies, etc., through extension continuing education programs in collaboration with veterinary colleges?
Yeah, I mean, I think that's a great idea. One of the things, since one of my other areas of interest is responding to disasters and looking at surge capacity. So, we have to look at what do we need on a day-to-day basis, because that's what actually keeps, salaries coming in. But then in an emergency, what do we need for surge capacity? I think for those some of the routine things that you're talking about, BSEs and bulls and things, I think first of all, people have to be interested. Not everybody wants to go out and do BSEs on bulls. One of my favorite things to do is trim feet on cattle, and that's not for even all bovine practitioners. So that's a tough issue. I mean, I think we have some of the resources. One of the things, since I'm in extension, that I've seen is extension resources have been dwindling over the years. And I'm in a state that I'm very lucky that we still have a pretty robust extension service. But so I think some of those things are possible, but whether or not people are going to actually come to the table and want to come to those programs will be interesting.
Okay, so the next question is from a student. I'm fortunate enough that our school has a separate large animal hospital and our food animal club is very active. But do you have any advice for ways that we as students can have a greater impact on improving the food animal curriculum throughout veterinary institutions?
Just, take advantage of everything that's out there. Again, one of the things that I think has come out of this pandemic is that, people are opening up access to things that were maybe only available to their students. And so there's a lot of opportunity out there right now, and hopefully that will continue depending on what you're interested in. Working hard to find every opportunity to get experience, learn from different practitioners, and then just keep an open mind. We all know now that we have plans, and then those plans get turned upside down. So stay flexible.
All right, next question. You mentioned early that our profession needs to do a better job selling ourselves. I totally agree. Now, what areas can we focus on which we can monetize and will translate to profitability for our clients? Are there also ways to model practices to leverage basic practice and higher level services like consulting?
That's a great question. And one of the things that we have discussed on the private practice area is the variety of practices out there, and the business models are so diverse. You know, the species models, you know, the species that a practice looks at, and it's very difficult to have like a kind of a one, if you plug your practice into this business model, it's going to work. There are certainly best practices out there that I think every practice can take a look at. And I think the hard part is for the owners and managers of those practices to find the time to get that done. You almost, you know, need somebody that's dedicated to doing that, because those things are easier said than done. And in the short term, the organization of them is not going to make you any money, but in the long run, hopefully it will drive some revenue, and will also drive that revenue and, you know, diversification, whatever is going to drive maybe some recruitment and retention.
Okay. What role, if any, do the pre-professional programs have on the retention of food animal veterinarians?
That's a great question. And since I'm in an animal science, actually housed in an animal science department, that's something I think about. If you look at our animal science students, whether it's at LSU or Texas A&M that I'm familiar with, or anywhere, about 80% of those students, you know, are pre-vet. But a majority of those are, you know, looking towards small animal. And so I do think that our animal science programs have suffered just like our, you know, food animal programs at veterinary schools. Also, you know, decrease in funding to universities. We've had a lot of attrition. And so it's very difficult to keep up with what these students need to come out with. But very good, robust animal science programs are a must. We know that those are probably likely where those food animal students are going to come from. You know, veterinary students don't have to go through through animal science programs. They can come from other science or non-science curriculums. So I think it's really important that we maintain that strong livestock and poultry and aquaculture programs in, and I think it needs to go back all the way back, you know, to pre-college.
Okay. Next question. Is there a model like in human health where we now have physician assistants and nurse practitioners in veterinary medicine?
Not at this time that I'm aware of. I actually, through my work with North American veterinary community, I get to work with other board members who are actually veterinary technicians, nurses, and this is actually being discussed because there's a problem with recruiting and retaining veterinary technicians also, and there's student debt and salary issues there. And so finding ways for students to maybe, you know, veterinary technicians to kind of go up a level into a, you know, more of a physician's assistant, that's going to require not only developing those training programs, but also some Practice Act changes, because, and this is, you know, stretching the bounds of my knowledge on this issue, but there's some Practice Act issues that have to be addressed both on the veterinary technician side, but also if we want to adopt some type of model. But there are conversations going on out there about that. I think it's a great idea. It just logistically needs to happen.
Are there opportunities to strengthen the feedback loop between supply and market demand for food animal veterinarians, particularly the role of universities to measure and respond to the demand? How do we know if the changes in the number of FAVs being trained over time are not in the response to actual demand?
Well, that's a great question. And that's you know, it's $1 million question, because these, you know, these supply and demand studies take a huge amount of resources. they're done on a national basis, so they may not actually reflect what has to go on a local level. And then by the time they're published, they're probably out of date. And then along comes a pandemic, or, you know, heaven forbid, an FAD to just totally upset the apple cart. And so I think the only thing we can do is be responsive. I think the marketplace is going to, take care of itself to some extent. It's on the public health side that I think we have to pay attention and, make sure that we have either enough veterinarians or enough surge capacity to take care of things when we need those. I hope that answers the question. That's a tough one. I'm happy to converse about that on email or on the phone.
Okay. The next question is, what is the amount of student debt that most FAV graduates have, and how does that compare with other professions like human health, doctors, etc.?
That's a great question. I don't have the numbers right on top of my head. In general, I think student debt for veterinary students is not far away from med students. And then that brings up, that there are definitely salary discrepancies. So if you're going into human medicine, there's probably a better chance of getting a higher salary depending on what area you go into. So as far as for food animal exclusive, those salaries for years have trended a little bit above the average. So I think there's definitely, it's working, but that is a minority of veterinarians. Remember, even, it's not all food animal veterinarians. And so there's some areas that we definitely need to work on.
Okay. And one final question for you, Christine. Will these slides be available for download?
I'm happy to provide these slides. If that's okay, I'll have to get permission from CAST. The webinar I know is being recorded, but let me talk to the CAST staff and we'll see if we can make those available.
Okay, thank you very much, Christine. And thank you everyone for asking questions today. Unfortunately, we couldn't get to everyone, but there were some great comments made within the group chat. I'm gonna go ahead and hand it over to Kent Chesky now, who will leave us with a few closing remarks.
Thank you, Christine. Thank you again for a great presentation and for the questions that you handled. And again, we're happy to work with Christine to make these slides available. As was mentioned several times, this video is being recorded and will be available through our website for viewing. We hope you enjoyed it, and we're open for any feedback as we plan to use this technology, especially over the next several months, to continue to share information about CAST papers that we are releasing. I'd like to acknowledge and thank our friends at Dairy Management Inc. for their assistance in helping provide this webinar. And I'd also like to invite you to join us for some upcoming webinars. We've got another one on producing food products from cultured animal tissues based upon a new CAST commentary. We'll be releasing that paper on April the 27th, and we're planning a webinar on April the 28th. We have another paper in May, the need and challenge for effective stewardship and new crop protection technologies. And that one we have scheduled around mid-May. And as we know more about the exact date of it, we'll be getting information out on that as well. And we have a paper coming up in June that's looking at the microbiome's positive impact on crops. And again, that paper will be shared by webinar. We're not sure with the current COVID-19 pandemic when we'll be able to return to DC and doing these briefings in person, but it is our intent to continue to share this information to webinars to folks, particularly those outside of Washington, DC, that aren't able to sometimes attend our webinars and learn about them. So please stay tuned, and we hope to reach out to you. And if you want to get on our list to receive updates about future CAST rollouts and webinars, just send us an email or go to our website and leave that information. I'd like to thank Dr. Navarre and all of the people who served on our task force to help make this possible. And I want to thank all of you for joining us today. stay safe and be well. Thank you.